Hello and welcome to this Mental Health for All webinar. My name is Niall Boyce. I'm the editor of the Lancet Psychiatry, and these webinars are an initiative which we've been running for a while in collaboration with United for Global Mental Health, MHPSS.net, and the Mental Health Innovation Network. Now, those of you who've been with us since the beginning will notice that we have rebranded. We were originally COVID-19 and mental health. We are now Mental Health for All with the hashtag MH for All. And this really reflects the changed circumstances in which we find ourselves. These webinars started off as the response to an acute crisis. It's become very clear over the past 10 months that this, besides being an acute crisis, represents a considerable change of circumstances. We are all in this for the long haul, and we need to adapt to this changed world. So it's very appropriate that today's webinar concerns the build-up to the big day in the calendar for mental health professionals, service users, anyone with an interest in the subject, and that is World Mental Health Day on the 10th of October. Now, the theme of World Mental Health Day this year is Move for Mental Health, which is also a hashtag, really increasing financial investment in mental health. And I'm pleased to have a fantastic panel here to discuss this particular topic. I'm joined by Ingrid Daniels, the president of the World Federation for Mental Health, Alison Brunier from the World Health Organization, Taha Sabri from Speak Your Mind Pakistan, and Eleni Misganaw from the Mental Health Service Users Association of Ethiopia. So good afternoon to all our panelists. We've got 45 minutes to discuss some very complex issues, so I'm going to go straight into it. And I'm going to start off with a question for Ingrid. Now, Ingrid, as the president of the World Federation for Mental Health, what made you decide that this year's World Mental Health Day should be about greater investment and greater access?
Thank you, Niall. Good afternoon, everyone, or I should just say greetings to everyone. So the World Federation for Mental Health chose a specific theme, a mental health for all, greater investment, greater access. And, you know, the theme was chosen because of the global mental health landscape that presented itself to us. We know that close to 1 billion people live with a mental disorder across the world. We also know that mental, neurological, and substance abuse disorders exact a very high toll on health outcomes. 13% of the total burden of global disease is as a result of mental disorders. We also know that every 40 seconds, someone dies by suicide. So this is the context in which this theme was chosen, mainly because if you look at the massive treatment gaps, 50% of people who live in high-income countries have no access to mental health care. 85% in low-middle-income countries have no access to mental health care. Yet, when you look at the global average health spend on mental health, it is only 2%. So how do we begin to address these huge and large treatment gaps when only 2% of health budgets are invested in mental health? We know that for every $1 spent and invested in mental health, we have a $4 return on investment in health outcomes as well as productivity. So there can be no debate that we require greater investment in mental health, particularly now during and as a result of COVID-19 pandemic, in which we've seen a significant amounts, billions will be affected as a result of the COVID-19. The mental health consequences will be enormous. And so now more than ever, we are calling for an investment in mental health. We need to shift the agenda. We've been talking about it for the past 2 decades. We've been calling for this. So we want to see the move, because the investment in mental health is not an expense, it is an investment. And our call is a simple one. We want massive upscale, we want massive closure of the treatment gaps, and we want a massive investment to ensure that everyone, everywhere, has access to mental health. So that's really why we chose the theme. It's become more and more critical and important that we call for this investment at this particular stage in the history of the world. We're living with a pandemic that is really encroaching on the mental health of people across the world. So mental health for all, greater investment is a massive call right now.
So I'm just going to turn to Alison because I'm just going to pull on two strands there, which Ingrid raised. Now, the first is that there's clearly this ethical duty to help people who are in mental distress, who do need professional help with the problems which they're facing in their lives. There was also, if you like, the enlightened self-interest argument that this is an investment, that you invest $1 and you get a return. So Alison, from your point of view, what do you think are the best arguments for investment, greater investment in mental health?
Well, thank you, Niall, and thanks, Ingrid. I mean, Ingrid has very clearly laid out what the public health rationale is for investment in mental health, and she's absolutely right. I mean, there's been a chronic underinvestment in this area for several decades now, and there is nowhere near the level of investment that's required to meet the needs of the population. What Ingrid didn't, I don't think, refer to, but is another important point to note, is the lost productivity that results from very common disorders such as depression and anxiety from people not being able to work, for example, which totals, it's estimated to total $1 trillion every single year. So there's also that cost of not taking action. The other thing I'd just like to mention is that there are solutions. Many common mental disorders can be treated relatively easily with medication, talking therapies, or a combination of these at relatively low cost. In countries where there are very few or just a handful of psychiatrists, generalists can be treated to diagnose and treat common mental health disorders. And this has been done through WHO's, for example, MHGAP training program for generalists. And support for people with mental disorders has been scaled up quite massively in around 100 countries through that program. And also just thinking, we haven't talked yet about other disorders, neurological disorders like dementia, behavioral disorders like autism. What can also be done is provide quality training to caregivers of people who are looking after children, for example, with autism, and older people who have dementia, so that the lives of these people can be vastly improved. But that too needs investment in order to scale up programs for training for caregivers. So a lot of the solutions are there. We just need this, as Ingrid has quite rightly said, quite a massive scale up in investment at all levels.
Okay, so Alison, at the moment, as I mentioned at the beginning, there is this pandemic on, and ministers of health, governments have a few things on at the moment. Why should mental health be prioritised in all of this?
Well, it's a very good question, and what we do know from other humanitarian emergencies is that people's mental health suffers. I mean, since the beginning of this pandemic, we've heard a lot of stories about the fear, the anxiety of first of all being infected, of losing loved ones, of not being able to work, of children not being able to go to school. So there are all of these existing anxieties that are exacerbated by a pandemic like this. And then there is also the concern of people who do have already mental health conditions and are no longer able to get treatment in the same way as they were before. We do know that from what we're seeing and hearing from countries is a lot of the healthcare services for people with mental disorders are no longer functioning as they have been before. In some countries, solutions have been found, such as telemedicine and other ways of providing people with care. But we also know that many people, their conditions have got worse because they haven't been able to access that treatment. And we're still, as everyone knows, that we're not at the end of this pandemic yet. So although we can't predict the future, what we can say based on what we've seen in past emergencies such as this one is that there is the risk that there will be more people with mental health conditions, and people with existing conditions may increase. And another factor here, maybe a last one to mention, is the economic uncertainty, with concerns about a potential second wave and whether there will need to be even more physical restrictions than there are now, with all the corresponding concerns about people's livelihoods. So that's why really it's more important now, more than ever, to take this issue seriously.
Okay, so if anything, the pandemic puts mental health up the list of priorities rather than
Correct.
the opposite. So I'd like to turn to Taha now. Now, what is the Speak Your Mind Pakistan campaign doing for World Mental Health Day this year?
Yeah. Well, Neil, we're quite excited for this year because as Ingrid and Alison already mentioned, mental health is on the policymakers' agenda, because after COVID, it almost all segments of society were affected. And this, of course, the COVID pandemic is a huge disaster, but there are opportunities in times of crisis. And I think now is the opportunity for mental health and the importance of mental health to be recognized. So in Pakistan, what we did as any Speak Your Mind partner, we've developed a coalition, a mental health coalition of different organizations working towards the same goal, but different aspects of the same goal, like in primary prevention, secondary, tertiary prevention. So we all came together, and then we approached various state organs, and we brought on board the Federal Ministry of Health. We're now signing a signed agreement with our Ministry of Health, and we've also brought in the Planning Commission of our country, so we're now signing an agreement with them. And then we have brought on board a lot of media houses, a lot of educational institutions, other like PR firms, marketing firms, businesses, and to actually sort of make a case for mental health. And we are very excited to participate in the 24-hour virtual march, which is being conducted by SYM on 9th October, in which 20 countries will get 1 hour with 4 hours for different themes. And Pakistan, in the hour for Pakistan, we are proud that we have been able to get the Minister for Health of our country, the Federal Director General of Health, the Special Assistant to the Prime Minister on Health has also made a speech, along with the WHO country head, along with various experts, survivors, celebrities, and we're really hoping that it'll have a huge impact. So we're very excited, and we're quite burnt out as well. There's been a lot of work, but we're very excited about it. So yeah.
It sounds like a lot of work. It sounds like getting a lot of people on board, the public sector, not just health, education, the private sector, individuals, NGOs. It's really a very sort of multilateral effort. I'm going to turn to Eleni in a moment, but I'm just going to say that if you have any questions, do put them in the chat box and we'll get around to as many as we can. But for now, Eleni, for you in Ethiopia, what does greater investment and greater access look like? I think you're muted, sorry. There, you just need to unmute yourself.
Yes.
Brilliant.
Yes,
Thank you.
about that. Thank you, Neil. Yes, for me, as a service user living in a country, low-income country as Ethiopia, access and investment in mental health is primarily a basic human right issue, as basic as that. And access in terms of, not only the number of mental health services, but also the quality is very important, is a priority. As Ingrid has already mentioned, the Ethiopian mental health sector is no different than the global mental health landscape. We have a treatment gap as high as 90% for severe mental health conditions, and services being confined in major towns. And for me, as a service user, access to mental health service means, having less expenses for, most of the services are accessed out of pocket in Ethiopia because we don't have a strong health insurance and social security systems. So this is really straining, especially at this time of the pandemic. This is very stressing for the individual service users, for the family, and for the support system around the service user. And for me, access to service and investment in mental health is to, has to address twofold perspective from the supply side as well as the demand side. From the supply side, we have a very limited number of professionals and less treatment options, and in terms of the supply side, we have very, very low access to mental health services, sometimes as low as 0% in some places. So from the demand side, mental health access in Ethiopia, it's loaded with stigma and discrimination. The service-seeking behavior is very much limited because of the high level of stigma in the country still. So for me, as a service user in Ethiopia, access to mental health service is as basic as a human right issue. And investment in mental health in Ethiopia is also should be a priority, like in any other low-income country. Ethiopia is no exception. Mental health expenses and budgets go as low as 1%, less than 1%, like 0.9% of the total health budget. And for me, investing more in mental health is more than, as Ingrid mentioned, more than an expense, but a return, a high return. And the investment should not also be focused on the treatment side, but also on the prevention side as well. And we have also to recognize the role of service users, not only in advocacy, but also in actual implementation and, widening of services and investment in the country. Thank you so much.
That's quite a stark picture you've painted there of low investment, of services which are unavailable, of people who are perhaps worried about accessing services. What progress have you made with mental health?
We should recognize that there are many progresses, like a decade ago, we had only one specialized hospital for mental health services in Ethiopia in the capital city. But now with, with the widening of and mainstreaming of mental health services in the primary health centers, this is a very commendable progress. And we are also having more and more political will to focus on mental health. At least we have a mental health case team very well organized within the Ministry of Health. This was not the case 5 years before. So, and also the Health Act is being drafted now with mental health issues being addressed as one part of the comprehensive health sector. So brighter days are ahead, I should say. Thank you.
Okay, well, that's an optimistic note, which is good to hear. And with that in mind, I'm just going to turn back to Ingrid. What is the World Federation doing for World Mental Health Day this year, and how can people get involved? And you have to unmute yourself, I'm afraid.
Sorry, I'm so excited to tell you what we're doing that I forgot to unmute myself. So it's really exciting this year because we are collaborating and working very closely as 3 major global partners. That's the World Federation for Mental Health, World Health Organization, and United for Global Mental Health through their Speak Your Mind campaign. So it's going to be a massive, massive campaign, which has started already. We did our joint press release on the 27th of August, and you can access it on any one of our platforms. So the World Federation for Mental Health, thereafter, we launched our mental health for all, greater investment, greater access, educational toolkit. So it's downloadable from our website. It's easily accessible. It can be used by anyone who needs to have access to the information. And they're really, really good articles that have been peer reviewed. And then we have ourselves obviously launched our press statement, and we have a patron for our event, who is the Princess Iman Afsan Al Sultan Abdullah from Malaysia, who has called for this great investment in mental health. And she's really basically saying it's not only governments who should be investing, but all of us have a role to play in upscaling, in closing the treatment gap. But most of all, I think the activations have started. And so the massive campaign, which is the Move for Mental Health, Let's Invest, has started through the Speak Your Mind campaign. I won't speak to it because I know United for Global Mental Health Speak Your Mind campaign has already spoken, or will be speaking about it, and have already launched. And then we're doing the virtual global campaign, and this is really been powered by the youth sector of the World Federation for Mental Health, TriJog, and Youth for Mental Health India. And we are now gearing up for the big Global Mental Health Festival, which will be taking place from the 9th to the 11th of October. And we will be having the Global Virtual Forum with many, many presentations. We have already over 1,000 representatives who have registered. And this is really to open up the dialogue and to talk about this call for investment and ensure that the investment happens. At the same time, parallel to this, we're having the Global Art Exhibition, which is hashtag Art for All, powered by Artidote. And so we're going to have many artists, and we already have submissions from many artists across the world highlighting this call for a greater investment in mental health. We'll also, over the 3 days, have performing artists. And so really to have a great pull and focus on the call for investment. And at country level, we're going to have the various activations in Move for Global Mental, Move for Mental Health, sorry, including conferences, summits, workshops. And we have, for example, in South Africa, we'll be launching one of the largest Cape Town International Kite Festivals. It will be a virtual event with the theme hashtag Hope on the Rise, Mental Health for All. And all these events anyone across the world can participate. The one advantage that COVID-19 has presented to us, it's removed all the barriers. So we can speak to each other across the world, and we can participate in all these events across the world. The most important aspect about all these activations at global country level and within communities is that we can have this call and ensure that we have a massive investment and moving the investment agenda and making sure that we have mental health for everyone who needs it across the world. So it's really quite exciting. It's been a very busy period as we're all working together, and we have cross-branding of all the activations through the World Federation for Mental Health, World Health Organization, and also United for Global Mental Health. So it's going to be a massive campaign, and our hope is that we would see this investment, greater investment in communities, in countries, and that everyone who lives in it, all global citizens, will have access to mental health care.
Okay, so my next question was going to be to Alison to say, well, what's WHO doing for this? But I'm not sure what you can add to that.
Oh, thank you, Niall. Well, I do have some things to add, but
okay.
Just to reiterate what Ingrid said, I mean, we're all very excited this year. I've worked on a few World Mental Health Day campaigns over the years, but it's never been quite like this one, and I mean that in a good way. We are working very hard together on this collaborative Move for Mental Health social media campaign, which will be launching next Monday. The other thing that WHO is working very hard on is preparation for our first online global advocacy event, specifically focused on mental health, called the Big Event for Mental Health. And this will take place, again, general public audience, open to all, starting at 4 o'clock Central European time on the 10th of October, Saturday. It'll last about 3 hours, and we'll be joined by Dr. Tedros, the WHO's Director General, world leaders, several heads of state, heads of government who have already shown that they're committed to investing in mental health care, celebrities, mental health experts, and activists who are speaking about what they have been doing and what advice they have for our general public audience for investing in one's own mental health. And in addition, we will be showing through human stories in different parts of the world the range of the work that WHO is involved in, not only in mental health care and prevention, but also projects for alcohol and substance abuse disorders as well. So it'll be, I'm very excited about the event. There's a huge amount of interest. We'll be putting out a press release, all being well, on Thursday with the lineup of who's participating. And then next week, as Ingrid's mentioned, we will come together for the social media campaign, in which everybody who has access to social media will be able to get involved. And perhaps just an additional point to mention, as part of the Move for Mental Health campaign, United for Global Mental Health will be launching an anthem, which I think is probably the first time we've launched an anthem for this day, which brings together some international artists from around the world with a specially commissioned piece of music that will be part of the social media campaign. So watch out for that too.
Thanks. So I'm just going to turn to Taha again. Now, all of these kinds of things, the artistic involvement, the marches, the hashtags, does it actually make a difference? What's happened in Pakistan? What have you done to move towards greater access and greater investment?
So Neil, I think that what has made a difference, as Alison mentioned, that this is the first time that, in a way, this is the first truly global mental health advocacy campaign, and global in the sense that it always happens. It's like celebrating a country distinctly, but it's never sort of a consolidated, coordinated effort. I think this is the first time it's happening, and I feel that adds a lot of value, because even convincing the policymakers was much easier, convincing the media houses was much easier when we said that we belonged to an international coalition, and which included the WHO, which included so many countries. So I feel that like we have seen the impact visibly. UGMH, Speak Your Mind, and all the numerous partners, I think they've started something really special. And for the first time, I feel that like this, and of course, COVID presented another opportunity, but I think for the first time, like as Alison mentioned, a consolidated global movement is happening. And to answer your question, yes, it would be very difficult for it to happen without this global umbrella to support us, moral support, in terms of structural support, and of course credibility as well. Because when if someone feels they're part of a, if I tell a policymaker that your video will run at the UN, they'll be much more impressed than at a local TV channel. So I think all of those factors have added a lot of value and have enabled us to achieve the success that we have achieved.
Thank you. So we've talked about the big and the local picture, and I'd like to, the last question for the panel before we go to the Q&A is really for Eleni, and this is again about the local picture, which is what's planned in Ethiopia for World Mental Health Day.
Okay, thank you, Neil. Yeah, for the Mental Health Service Users Association, the World Mental Health Day this year is a very important landmark, because we have been selected to co-chair the day's event organizing committee, with Ministry of Health being the chair, And this recognition by itself is means a very an important thing for us. You know, service user involvement is a new phenomenon in countries like Ethiopia. So at this event, not only we are co-organizing with the Ministry of Health, but also we have a slot to reflect our perspective on how best to involve service users in promoting access and increasing investment in mental health. So we will have a session where we will highlight best experiences from other countries where service users have been very much actively involved in improving access and investment in mental health. So we will have that session. We very much look forward to it. And besides that, we have also social campaigns where we will share our lived experiences to tackle the stigma and the low access and investment in the country. So we will be involved in that. And that event that I have talked earlier will be also available online for as many as inclusive as possible. So it's a very important event and day for us, really a benchmark for us. So thank you so much, the organizing committee and WHO for choosing this important topic. It's very timely and we can't thank you enough.
So I have another question to follow up because I've just looked at our Q&A list. And the first question I think is one for you to start with, which is someone who has emailed. They say they've got lived experience and they're curious, what role do you envision for experts by experience in policy advocacy and care provision? So would you like to start with that question?
Yeah, thank you very much. I'm so excited to answer that because it's very much close to my heart. So service users are, of course, experts by experience, and not only in advocacy, but also in designing policies, in improving service delivery. Their involvement should be a priority at all levels, you know. Sometimes we tend to involve service users, experts by experience at some level, but it has to be a very meaningful participation, and not only in giving inputs to policy, to frameworks, to strategies, but to researchers, but also in setting priorities, you know, for research, where the money should go, because they are best placed to know if services are really delivering what they are intended to, and if they are delivered primarily focusing on the service users, the end users' preferences. So service users and people with mental health lived experience should be meaningfully involved at all stages of policy development, research priority setting, actual implementation of researches, and also at you know, designing services themselves. And I will also add peer support also should be recognized and promoted and invested in for being an alternative, a complementary treatment option together with conventional treatment as well.
Right, so,
thank you.
Thank you, Eleni. So it sounds to me as if, you know, the service user voice is so important because it's the point at which all of these big, perhaps sometimes rather abstract ideas get converted into practical realities, which change people's lives for the better. Alison, would you agree with that?
Wholeheartedly, yes, and this is very much a part of WHO's thinking. We have a program called Quality Rights that's been introduced in a number of countries to try and ensure that people with lived experience are really at the heart of work that's done at country level on policy development, on working on legislation that's been referred to earlier by Eleni, and really making sure that service users' opinions and needs are really considered when working on the implementation of programs. With regard to Mental Health Day more specifically, we too have tried to ensure that in the program for the big event for mental health, we do have the voices of people with lived experience. In fact, in many of the videos that are in production. So that will come across very clearly during the course of the event. But in summary, yes, I on behalf of WHO, couldn't agree more with what Eleni has said.
Thank you. So the next question I have, this person has watched the webinar. They've said the urgency is clear for this need for greater investment, but asks how can we support this call for investment? And by we, I think they say, what can care providers and recipients do now on Mental Health Day and after? So Taha, what can care providers and recipients do specifically in your setting right now to help?
So I think the best part about this World Mental Health Day is that everyone can contribute. And for the Speak Your Mind movement, you can essentially contribute in 3 ways. The first one is actually watch. It'll be a beautiful event, amalgamation of people from different cultural contexts and diverse voices of, as Eleni mentioned, the most important, people with lived experience, then experts and policymakers. A second thing you can do is to move. So what Speak Your Mind is doing, we're launching a campaign on, we're launching a filter, which is basically a virtual march. So you can use that filter and you would appear, you can use Instagram or Snapchat, or in that filter, it would appear as if you're marching with a lot of people holding banners. So it's a very fun activity. You can take a short video with that filter, upload it on a different social media platform, tag your friends, and it can be like a very communal activity. And the third thing you can do is share as much as possible, talk to people about why mental health is important, talk to people about, and they will be very receptive, particularly after COVID. Everyone has undergone some degree of distress due to this crisis. So I feel that if you want to participate, you are more than welcome to, and there are several ways that you can do so. And if you want to learn more, go to moveformentalhealth.org. I think they'll also share the link with you after the session.
Thank you. Ingrid, do you have anything to add to that?
Yes. So, you know, at country level, there's a lot of activation happening. And as you've said, you know, we at country level, people can participate in various activities. And there's the Move for mental health, which is the call to move, the investment agenda. Get involved in the social media posting, you know, give comments, write letters to your governments asking for the greater investment in mental health. Get as much media and exposure as possible, because, you know, media is powerful, as we know. And I want to emphasize, you know, the voice of the person with a lived experience is far more powerful in bringing this call to the fore. Yeah, as part of the campaign, we have the Clubhouse International, who are people with lived experiences across the world engaging in the move for mental health, moving the agenda. So there's a lot of activities, and even have small Zoom forums if you have to start the dialogue, to engage in the various platforms that are being provided. It's going to be a busy period, and I don't think we are short of any kind of options for people. You know, it's such a wide range of activities and call, but use media, use social media. Those are powerful avenues that we can use to bring about greater awareness about this event. We are also saying that we need to, you know, put our money literally where our mouths are, as the World Federation for Mental Health. So we've established a global virtual hall where we are asking people to really donate a brick. Basically, it's a virtual brick, because we want to create small grants for non-profit organizations working within the mental health field at local level, to be able to continue their work. So it's really that great investment. So, but it's for everyone. Everyone has to to play a role in this investment agenda, be it as a mental health service provider, professional, a volunteer, person with a lived peer interventions, very important. So I think it's a united voice, it's a united global voice that is going to pull the attention, and I don't think people can ignore it, because it's going to be so powerful. It already is, and I think it's probably one of the biggest campaigns we've seen in a long time, because of this massive collaborative partnership efforts that we put into and calling attention to the specific agenda around investment and making mental health a reality for everyone.
Thank you, Ingrid. From my point of view, I've been very concerned for some years that a lot of the discussion around mental health has perhaps rightly been around stigma and it being time to talk and it being good to talk. But however much you push that message out there, if there are not the services for people to talk to, if they can't access those services, then that message is it's of very limited utility. So I'd like to end with a quick final round of questions, and we've already mentioned the hashtags MH for all and Move for Mental Health. So I would like you to make these answers of tweet length, if possible. And the question is, what would you see like to come out? What would you see coming out of World Mental Health Day this year? What would you hope comes out of the day? And I'll start with Eleni, please.
Thank you, Neil. Yeah, as service user and a representative of lived experience, from this World Mental Health Day, I do hope that the involvement of people with lived experience would shine out, and policymakers, stakeholders, researchers, and everyone in the field would start believing in lived experience and doing it meaningfully, and more money to come to the sector.
Thank you. Alison, what do you hope comes out of World Mental Health Day this year?
A couple of things now. One, that everybody that involves themselves in World Mental Health Day in any way has a better understanding of what they can do for their own mental health, firstly. And secondly, that governments, civil society, business leaders all go away from this day thinking, okay, I'm going to invest in mental health. How do I do it? And move on to the next step. So it's not just awareness raising, but actually making it concrete. Actual action.
Okay, Ingrid.
What we'd like to see as an outcome of World Mental Health Day is an indefinite increase in budget spend in mental health across the world, not in infrastructures, not in facilities, in community-based mental health initiatives that includes the voice and the interventions of persons with lived experiences. There are creative mental health innovations that has an incredible impact. We want to see that shift. We want to see a greater partnership between governments, private and public sectors to ensure that this happens at country level. But most importantly, that the dialogue does not stop and the pressure does not stop on the 10th of October, that we continue this discussion, this engagement, this call to action. We need to see this outcome. Otherwise, I believe we will continue to see these treatment gaps get even wider because of the mental health consequences of COVID-19.
Thank you. So finally, Taha, starting October the 11th, 2020, what would you like to see changed?
So, Neil, having been working in this field, being an activist, an advocate, a user, but also a physician for the past 5 years, I hope that this day would show other activists, other sufferers, other people yearning for change, that by mobilizing together, by joining hands, we can achieve an impact. And I hope that would give hope to other, and we only have 19 countries in the campaign right now. I hope that at the end of this campaign, we have like many more countries signing up. And so every single year, I hope the momentum continues and grows until the world cries with one voice that we must move for mental health, and we must invest in mental health.
Thank you very much. So World Mental Health Day all year round. That's the aim, it sounds like. So, of course, we are keeping going with these webinars. The next webinar in this series is on the 13th of October, which is on education and mental health. Please do go to the United for Global Mental Health website where you can find details, you can register, and you can join us. I've also been asked to mention the next DevEx and Global Mental Health Action Network event, which is next week. That's on the 6th of October. It's at 2 p.m. BST, so that's UK time. And it's on delivering mental health care for all, why investment now is crucial. So a topic appropriate to today's discussion. And this will include Devorah Castell of WHO presenting WHO's rapid assessment of service delivery for mental, neurological and substance use disorders during the COVID-19 pandemic, which will be published on the same day as the webinar. She'll be joined by some great guests, Shantha Rao Bariga from Human Rights Watch, Raj Mariwala from the Mariwala Health Initiative, and also Cecilia Vartho-Jones from the Bernard Van Leer Foundation. And the details of that event should be going in the chat as we speak. But for now, thank you very, very much for joining us today. Thanks to all our panelists for such a great discussion. I really hope that all of these many exciting plans for World Mental Health Day go very well, and that we do indeed see the tide turn towards greater investment in mental health for all. Thank you very much for joining us. For now, goodbye.
Goodbye.
Thank you. Bye.
Thank you. Goodbye.
Bye.